People always ask doctors what's eventually going to drive them out of medicine. They assume it's burnout, paperwork, insurance, administration. For me, it's actually none of that. Let me show you why. This is a text message I received from a patient just yesterday. Bone on bone is extremely painful. Simple walking from our kitchen to our bedroom literally brought me to tears. I can't thank you enough for fixing that for me. I trust your expertise as a fine surgeon. A surgeon who absolutely puts his patient's needs first. You are also a very fine person who leads with care and kindness. I am healing beautiful. My heart is happy. We wish you and your family a very happy holiday. Fantastic, right? That text means everything to me. It's why I do this. It's why I show up every day. That's the privilege of being a doctor. Then, on the very same day, I received this. This is a public Google review on my Google website. I had a hip replacement in January 2025. From day one, my leg felt longer on the surgical side. My hip swelled so badly, the pain was so bad, I could hardly walk. No PT was ordered for the first 6 weeks. Now, I have terrible back pain that I never had before. I wish I had never had this surgery. I'm now not able to do the things that I love. I'm going to a different doctor because this guy tells me how perfect you are and how perfect his surgery was. Furthermore, I paid for concierge. Right? That review was posted the day before Christmas, the same day I received that text message. Just a few short hours apart, I want to say something here that might surprise people. I know a lot of surgeons, really good surgeons, they get reviews like this too, and it doesn't affect them at all. At the end of the day, we're orthopedic surgeons, right? We're supposed to have skin tough as nails. They read it or they don't, and they move on. They sleep just fine. That is not me. I'm sort of an empath, and it's taken me a long time to realize that. But because I'm an empath, one of the strengths and the weaknesses of being one of those empaths is the need to please everyone. You don't just want people to get better. You want them to feel heard, seen, cared for. And when someone publicly says you failed them, well, it cuts deep. It's the kryptonite. There's a saying in surgery that you're defined by your last complication. But for me, I'm defined by my last negative review. This is my kryptonite. Not because I'm afraid of one unhappy voice, but because of what one bad review does to me, how it lives in my head, how it follows me into the operating room, how it makes me question myself. Even when the outcomes, the data, and the hundreds and thousands of people I've helped all say otherwise. I can have 100 positive reviews, hundreds, thousands of people I've helped with excellence, and one negative review outweighs all of it in my mind. That's the cost of caring this much. Surgeons who aren't affected by this, you might ask, they're probably better protected emotionally. I envy them in a sort of way, but they don't carry this home. They don't replay the conversations. They don't lie awake wondering if they could have said one thing differently or done one thing differently for a particular patient. This review came a year after I did her surgery. I haven't seen her in months, maybe even a year. But guess what? I do care. So if you're unhappy with me, I really want to know. But don't reduce me to a public review. Come into the office, sit across from me, have the courage to talk to me like another human being, because I will listen and I will try to help. That is my charge I give to you. Sometimes the problem isn't the hip. Sometimes the hip is technically successful, but it uncovers something else. Sometimes other things go on, a back issue, a gait issue, or something in life that finally has a place to land. And it's easier to aim that pain at a surgeon than to unpack it. I'm still a human being. An empath, maybe a little broken, but still an empath nonetheless. I'm just another human being trying to help other human beings move through this game of life as best I can. You're not necessarily a number to me. I really care. And if that makes me vulnerable, so be it, because it's also what makes me care. Thanks for listening.